Hello, everyone. My name is Cheryl Matthews, and together with Mackenzie Lee, we will be presenting a critical review of family planning and public health. Family planning is often associated only with contraception, but it is actually one of the most important preventative public health strategies for improving maternal, infant, and family health. Throughout this presentation, we'll discuss its history, major services, barriers to access, important policies, current challenges in Georgia, and recommendations for strengthening these programs.
Family planning in the United States has evolved significantly over the past century. Early efforts focused primarily on providing access to birth control and reducing unintended pregnancies, with advocates such as Margaret Sanger helping launch the movement. Over time, however, family planning expanded beyond contraception to include maternal and child health, preventative care, and reproductive autonomy. A major turning point occurred during the 1994 International Conference on Population and Development in Sarajevo, which emphasized reproductive rights and informed decision making rather than population control alone. Today, family planning is recognized as a fundamental public health strategy because it empowers individuals to make informed choices while improving health outcomes for women, infants, and families.
Family planning services extend far beyond providing contraception. They include reproductive life planning, contraceptive counseling, pregnancy testing, infertility evaluation, STI and HIV screening, preconception counseling, preventative health screenings, and patient education. Together, these services help identify health risks before pregnancy, encourage healthy birth spacing, reduce unintended pregnancies, and improve long term maternal and child health outcomes. The Title X program has established national standards that emphasize patient centered, evidence based, and equitable care. Therefore, family planning should be viewed as a comprehensive, preventative healthcare strategy rather than simply a reproductive health service.
Although family planning services have expanded considerably, many individuals still face significant barriers to accessing care. Financial challenges such as lack of insurance and out of pocket cost remain major obstacles. Rural communities often experience provider shortages, long travel distances, and transportation difficulties that further limit access. Social determinants such as education, health literacy, cultural beliefs, and stigma may also discourage individuals from seeking services. Additionally, policy changes and institutional practices can influence healthcare availability. Research demonstrates that these barriers affect multiple populations and contribute to ongoing health disparities, emphasizing that improving access requires addressing both healthcare systems and broader social conditions.
One of the most important federal policies supporting family planning is Title X. This policy was established in 1970 as the nation's oldest and only federal program dedicated specifically to comprehensive family planning services. Title X provides preventative reproductive health care, including pregnancy testing, contraceptive counseling, infertility services, STI screening, cancer screening, and reproductive health and education, particularly for low income and uninsured populations. From a public health perspective, the program has improved access and promoted health equity. However, regulatory changes such as the 2019 Title X gag rule illustrate how policy decisions can directly influence clinic participation and patient access to care, highlighting the close relationship between healthcare policy and public health outcomes.
While Title X provides the federal foundation for family planning services, states play a critical role in implementing programs that meet local needs. In Georgia, programs such as the Medicaid Family Planning Waiver and Planning for Healthy Babies have expanded access to contraceptive and preventative health services for eligible women. Research has shown that collaboration between Georgia's Medicaid programs and Title X clinics improves access by leveraging existing public health infrastructure rather than creating separate systems. These partnerships demonstrate how federal and state programs can work together to reduce barriers and improve maternal and child health outcomes. However, continued success depends on maintaining adequate funding and ensuring that services remain accessible across the state.
Family planning programs have produced substantial public health benefits over the past several decades. Increased access to contraception and preventative health care has contributed to reductions in unintended pregnancies, improved birth spacing, earlier prenatal care, and better maternal and infant health outcomes. In addition, these programs provide important services such as cancer screenings, STI testing, and health education, making them a valuable component of preventative health care. Despite these successes, challenges remain. Funding instability, workforce shortages, geographic disparities, and unequal access continue to affect many communities, particularly those that are rural or medically underserved. These ongoing barriers demonstrate that policy improvements must be accompanied by effective implementation.
One of the most important current debates in Georgia involves balancing healthcare access with changing policy and funding priorities. Although programs such as Title X and Georgia's Medicaid initiatives have expanded access for many women, provider shortages and transportation barriers continue to limit care in many rural communities. In addition, changes to Title X regulations have generated concerns regarding clinic participation and patient access to comprehensive reproductive health care. Because family planning clinics often provide preventative services beyond contraception, including STI testing, cancer screening, and health education, changes in funding may have broader public health consequences. Ultimately, this debate highlights the close relationship between public policy and population health, where decisions about funding and regulation directly influence access to preventative healthcare services.
Based on the evidence presented, two strategies could strengthen family planning programs and improve public health outcomes. First, expanding access in rural and underserved communities through telehealth services, mobile clinics, transportation assistance, and workforce incentives would help reduce geographic disparities in care. Second, policymakers should prioritize stable, evidence based funding for family planning programs such as Title X and Georgia's Medicaid initiatives. Consistent funding would allow clinics to maintain staffing, expand patient education, and provide comprehensive preventative healthcare services. Together, these recommendations would improve health equity while supporting healthier women, children, and families across Georgia and the United States.
In conclusion, family planning has evolved from an early birth control movement into comprehensive public health strategy that promotes maternal health, infant health, preventative care, and reproductive autonomy. Programs such as Title X and Georgia's family planning initiatives have improved access to care and reduced health disparities. Yet, significant challenges relating to funding, geography, and health equity remain. Therefore, family planning should be viewed not simply as contraception policy, but as preventative public health policy. When individuals have access to comprehensive reproductive health care and informed decision making, the benefits extend beyond the individual to strengthen families, communities, and population health as a whole. Ultimately, investing in family planning is not simply an investment in reproductive health care, it is an investment in healthier families, healthier communities, and healthier future generations.